Okay, hi everyone. We're now streaming live on YouTube. It is Friday, October 16th. Thank you for joining us today for this media briefing. Really, we just have an update today from Dr. Wang, and we wanted to have an opportunity for you to connect with us a couple times during the week in order to ask COVID-related questions. So I'm going to turn it over to Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Thanks, Julie. Good morning, everyone. I won't have all the stats I normally have on Tuesdays, but I'm just going to give a brief update on our overall trends to date, and then give an update on the Wilfrid Laurier situation, as well as talk about a few trends we've seen in workplaces, which could lead to higher risk situations. So we just want everyone to know about these trends, so they can continue to, practice the appropriate precautions. So if we start with the overall trends, at this time, as I mentioned on Tuesday, our rate of new cases is not accelerating. So is there some noise in the background? Sorry. Okay. So I'll just start over. So as I mentioned on Tuesday, at this time, our rate of new cases is not accelerating. This is in no small part due to the efforts of our residents in Waterloo Region, for which I'm grateful. We remain, however, in a precarious state, similar to other mid-sized regions in Ontario. Some of these regions are seeing continued increases in their rates. So we need to remain diligent with our public health practices. Regarding the Wilfrid Laurier University outbreak, as you're aware, on October the 12th, Public Health declared an outbreak at the university, both in residence and off campus. We now have a total of 16 cases associated with this outbreak. We have cases at the Clara Conrad residence with 3 wings in outbreak, at 2 other university residences at least, Waterloo College Hall and 260 Regina, as well as off campus. These are cases that have been associated either to previously linked study groups or are close contacts of cases themselves. Now our investigation is ongoing and the numbers will be updated on a daily basis. And I just wanted to add, there may be cases reported in residences, but the confirmation that they are linked to this outbreak needs to follow public health investigation and confirmation into that. So what we're providing you with is the information at this time based on confirmed links, and these numbers, will continue to be updated on a daily basis, and I expect that we may very well have additional cases in places that are linked. So all cases are being followed by public health, and high-risk contacts are being advised that they need to self-isolate and get tested. Public health continues to recommend that everyone have only close contact with those with whom they live. In the case of students in their dorm or room or apartment, and with everyone else outside of their dorm, their room, their apartment, physically distance and wear a face covering with everyone else. And we really appreciate the ongoing work with the university to provide support to these cases and contacts who need to self-isolate. So I'd like to talk now a little bit about public health precautions in workplaces and facilities. So as you may know, public health follows up with every positive case. and many cases also work outside of their home. And so we also follow up with various settings to reduce the risk of further spread in those settings. And so we have followed up with several dozens of workplaces. And what we've noticed is, first of all, many workplaces are serious about ensuring appropriate public health measures are in place. And this is great to see. In particular, in areas where clients or patrons may be present. Public health precautions, however, are not always consistently applied in employee-only areas. So common areas where we've identified increased risk include workers carpooling together, workers coming to work while symptomatic, in some cases despite screening measures in the workplace, and thirdly, not maintaining physical distancing in employee-only areas, such as in lunchrooms, break rooms, and meeting rooms. So I want to highlight this today to emphasize that it is important for employers and employees to stay vigilant with all recommended COVID precautions in order to prevent further spread and ensure that businesses can continue to safely remain opened. A few words about some of these areas. We've noticed a potential for increased risk. Carpooling. So if possible, don't carpool with those outside of your immediate family. If you need to carpool, limit the number of occupants in the vehicle, open the windows to create airflow, and ensure that everyone in the vehicle is wearing a face covering if they are not from your immediate household. Please stay home if you are sick. Do not go to work if you are showing symptoms, even if they are mild symptoms. All businesses are now required to screen workers and essential visitors entering the work environment at the beginning of their day, their shift, or when an essential visitor arrives. If you are an employer, we ask that you support employees who need to stay home due to symptoms or isolation requirements. Break rooms and lunchrooms. Stagger start times for shifts, breaks, and lunch times. Limit the number of people using lunchrooms at any one time to ensure physical distancing can be maintained. Ensure masks are worn, except when necessary to remove, to eat or drink. Arrange tables so that they are at least 2 meters apart. Stagger seating at the tables to prevent people from directly facing each other. Space out commonly used appliances like microwaves or toasters in lunchrooms and break rooms such that they are at least 2 meters apart. And disinfect high-touch surfaces frequently and in between lunch and break changes using a disinfectant that's been approved by Health Canada. So in closing, in wave 2 of this pandemic, the recommended measures of physical distancing, wearing a mask, washing your hands, staying at home if you're ill, and avoiding close contact outside of your immediate household will be important. And maintaining all recommended public health measures in the workplace will be important. Thank you to the residents of Waterloo Region for your efforts to date, which have so far moderated our growth in cases. Let's keep going so we can reduce risks for those in our long-term care homes and other vulnerable settings, keep our schools and businesses opened, and our medical and surgical procedures continuing. Thank you and have an enjoyable, safe, and physically distant weekend. I'm open to questions now. Thank you.
Thanks, Hsiu-Li. So we'll turn it over to your questions, and we'll start with Kate from CBC. Go ahead, Kate.
Thank you.
Hi.
Dr. Wang, at the end of your statement there, you were talking about keeping hospitals basically operating as usual and how important that is. There are currently 4 people in hospital. A couple weeks ago, there were none. 4 is not a huge number, but does it at all surprise you to see those 4 people in there at this point in the game? And does it concern you?
Thanks for the question, Kate. So it's not surprising. You know, we continue to see that the age groups where there's been the highest rate of growth in new cases has been the age groups under 40. But we have seen both provincially and locally that we're starting to see spread into other older age groups where people are more likely to be hospitalized. And we also know that in addition to that, that hospitalizations among those that are often more vulnerable tend to lag after the case numbers go up. So we've seen this more in other areas, like the hotspots in Ontario right now. Their hospitalizations are climbing at a rate that's faster than here. So I think we need to take a look at those trends and anticipate that may happen here if our growth continues to go up. So right now it's just 4 cases in the hospitals, and our hospitals are continuing to be able to maintain their procedures and try to continue to clear backlog, that was generated after the first wave, and they really want to try to keep that going, right? And so it's the same principle as trying to keep our schools open and trying to keep our businesses open. Those are things that we're able to continue to keep open at this time. And we just want to, it's all really dependent on community transmission, because that's what we've noticed in the second wave across the province and here as well. We start to see the impacts from an increased number of cases that first show up into all these other settings a little later, right? And so that's why we have to keep those overall transmission rates low in the community overall, so that we have less cases, less outbreaks, less closures in these other settings.
And I just wanted to touch on, this week we saw cases down in Hamilton at a cycle class kind of get out of control. What message do you think people in the region should take from that situation?
Yeah, no, that's a great question. First of all, that is concerning to me. I do know, that the provincial experts are looking into whether there are additional measures that need to be in place for such settings because of what they've seen in Hamilton, as well as some other areas in the province. And, I think what people should remember is, again, when it comes to close contact, unprotected contact with others, limit that to only those in your immediate household. And with everyone else, try to maintain physical distancing and wear masks. And if you do exercise with other people, be very, very vigilant about that. Try to maintain that distancing, try to maintain face coverings where you can, try to consider outdoor environments for exercise and try to consider exercising in smaller groups. So those are the things that can reduce risk.
Great. I'm going to leave it there. Thank you.
Okay.
Thanks, Kate. We'll move on to Joanna from the Record. Go ahead, Joanna.
Hi, Joanna.
Hello. Just a couple questions about the workplaces.
Yeah.
How common of a problem is this in workplaces, and why do you think some are lax with following public health measures?
Yeah, I would say that, as we have more cases and more workplaces to follow up, it grows every day. We're seeing more of this trend where, when we go into workplaces, we see they are making, lots of efforts overall, but it's more lax in the employee-only areas. And so I would say, there's a lot of workplaces that are diligent in all areas, but we're seeing this trend where, in some workplaces, it's lax in the employee-only areas. And oftentimes, it's not intentional, because when we point it out, when we go there, when we inspect, when we speak with them, they're like, oh, right, I've got to do that. So, that's why I wanted to really bring it to everyone's attention today. We really need to be vigilant and diligent and understand that everything we put in place to, to make sure that patrons and clients are safe, we need to do the same thing in areas where there are only employees. And, it's possible because employees know each other. They may think, oh, I know you and all that. But right now, with the circulation of COVID in our communities, there are no more social circles, so to speak. We need to stick to close contact only with our immediate household members. So this is another opportunity to remind people, even if they know each other, because they work together, they're friends, etc. They need to maintain physical distancing with anyone outside of their household and wear masks. The province recently introduced, as you may be aware, face covering legislation for the entire province. And this also includes workplaces. So in workplaces, even if it's only employees, right, they need to mask unless they can assure that they can maintain physical distancing, which we know isn't always possible in every circumstance in workplaces. And so that's why there was that mask legislation that was put in by the province. So I have heard that this is an issue that has been noticed in multiple other areas as well, which is why, as you may be aware, the province has announced that it has hired more workplace inspectors, that it's doing more workplace inspections, and it's trying to really increase the awareness and the knowledge of workplaces and workers and employers about all the necessary precautions that they need to take. And so, yeah, this is an area where, we don't always see precautions taken, and we really need to enforce that, because we really need to do everything we can to try to prevent further spread in workplaces that could affect the ability for facilities, workplaces to remain open.
And do you have concerns beyond the workplaces staying open? Like, what's the problem with them not following these measures and perhaps seeing more cases in individual workplaces?
Yeah, sure. No, that's true. I mean, it's important to try to keep businesses and workplaces as open as much as possible. But it's also important because if there's spread, say among coworkers, then there's a risk of further spread in their families, there's a risk of further spread, you know, to their social connections. And so, you know, that anywhere where there's an outbreak in one place, and it's not a closed place because the people are not in a closed setting, it could spread to other settings, other groups. So yeah, so we have to just in general, it's like when we have a cluster of cases anywhere, you know, it just increases the risk of further spread at the community level, like we've seen with the Spinco outbreak in Hamilton. Started at the gym and then has gone into multiple households, and then affected schools, and then affected workplaces.
Okay, thank you. I was waiting for my clock to stop dinging.
Okay. Okay. You can ask other questions as well if after.
Thank you.
Thanks, Joanna. We'll move on to Irene from Air News. Welcome back, Irene.
Hi, Irene.
Thank you. Thank you. Thank you. I'm glad it's Friday that we're having the meetings. Waterloo Region provides outbreak locations for schools, hospitals, retirement homes, childcare, but not facilities where there's access to the public. I'm thinking in particular of restaurants even, or dentist's office. I guess that's not quite so specific, but places where the public can travel. Does the region plan to become more specific in the facility outbreaks?
Okay.
As a side note, Brant County is providing locations.
Okay, sometimes we do provide locations when we feel that there is an increased risk to the general public, or when we need members of the general public to self-identify as contacts at risk of a particular setting. So otherwise, in order to keep the community informed about the types of setting that transmission is occurring at which we don't consider them to be at increased risk, we do it through the reporting that we've done to date, which is by category.
Okay, that's great. Thank you. I guess on the website though, would they ever be reported on the dashboard?
If we feel there's an increased risk to the general public of those settings, yes.
Okay, that's great. Thank you. That's my question.
Okay, thanks, Irene. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, I apologize. I didn't get on, when I did, anyways, wondering the workplace settings. Can you just repeat some of the things? Are you asking workplace settings to have temperature checks and all that stuff, the screening, and like all workplace settings, or are they just specific, like restaurants, gyms? Can you clarify what you mean by workplace settings?
Right. So any place where there are workers is a workplace setting, and workplaces have their own specific guidance from the Ministry of Labor. So workplaces are overseen by the Ministry of Labor, which is why sometimes, you know, if we see an issue in a workplace and we feel needs further investigation, we will engage the Ministry of Labor. So they have specific guidance, and depending on the type of workplace, they will have specific requirements. So on the Ministry of on the provincial website on COVID, the Ministry of Labor has put out over 150 different guidance documents for various sectors. So each sector should know, the guidance that they're supposed to be under. And, you know, we do try to promote the information that the Ministry of Labor and the province releases to our own local business associations. So Public Health has regular meetings with them, and we try to make sure that, we send to them whatever links that they likely are already aware of, but if not, we give them those links. So so I can't be specific about specific measures because it depends on the business, but in general, businesses, need to have some mechanism of screening their employees, businesses, workplaces, and they need do whatever they need to do to enable physical distancing, in all areas of their workplace, even in areas where it's employees only, and they need to ensure that with the new face covering legislation that applies across the province, and that they can enable the wearing of face coverings among their employees as well, even if it is only in settings where there are employees. So it's basically my objective today in highlighting some of these issues is to let our community know these are some of the areas where we've noticed it, it's not always consistent in terms of the application of the measures. And we understand too that there's a lot of things to be aware of. There's new guidance that can come out regularly. So we want to just highlight some areas where we've noticed some trends in, people not applying measures consistently, and some advice that we have for those areas.
Have you then seen an increase in cases amongst co-workers, which is why this is perhaps coming out? Like, is that?
Yeah. So fortunately to date, we've had many cases in workplaces, because many of the cases we have every day, they work outside of the home. We've had a small number of workplace outbreaks. They've been fairly well controlled. So far, so good. However, these are still, I don't want to wait until we have a bunch of outbreaks. These are areas of risk that we've noticed in workplaces, even if single cases then don't result in further spread. So that's why I kind of want to point them out now, so that we can all do everything we can to avoid further spread in such settings.
Okay, and one last question. I apologize if you spoke about the WLU outbreak.
Yeah.
Have all of the students or high-risk contacts associated with the study groups been tested? And given that a lot of the students went away for a reading week, and they are expected to come back this weekend, do you have any particular advice or rules, or you're asking these students who are coming back from outside Waterloo Region back into either residence or off-campus settings?
Right. So first of all, the investigation is ongoing. So what we've reported this morning is we are up to now 16 cases associated with the university. And we also have, in addition to the Clara Conrad residence, we also have at this point confirmed an association with cases that are living at 2 other residences, but that number may increase. We're still in the process of investigating. So the 2 other residences are, I'm just going to put up my notes again. Waterloo College Hall, 260 Regina, as well as, in homes off campus. So these are the cases that we have linked to date to the outbreak. And what we're linking to the outbreak are cases that are either associated with one of the study groups where we think the original cases got their infection, or they are cases that have come about as the result of spread from those original cases to other cases. And so we're counting them all to give a more accurate picture of the extent of the outbreak, even if cases actually are not currently residing in Waterloo Region because they've returned to their home area either for the week or continuing on. Because we know some have returned home because they want to stay home now. So that number the university might know more about, but basically, okay, so that's the answer. In answer to the first question, it's 16 to date. We could see more cases. We could see more residents linked, and so we'll provide that info, updated daily. But that's what we have so far. And in response to your second question, what I'm asking returning students to do, because they could be returning from areas that are higher risk as well as lower risk, it's the same thing. Please only have close contact with people in your own room or apartment or dorm room. Please physically distance and wear a mask with everyone else. Please do not try, please try not to gather with many people. Try to keep any gatherings, physical gatherings you may be involved in, to as little a number of people as possible. Try to hold those gatherings off site. And in fact, the safest thing to do is to gather virtually if you want to gather. So that would be my advice for all university students, whether or not they're returning from various areas. And in fact, for everyone in the region, those are the kind of main principles that I'm hoping people can continue to adhere to.
Okay, that's it for now. Thank you.
Thanks, Nicole. We'll go to Tim from 570. Go ahead, Tim.
Hi, hi, good morning. I apologize. I had some technical difficulties and I missed your opening remarks. I just had a question regarding elementary school outbreaks and high school outbreaks. What is your messaging to parents? Is it the same along with all the other messaging towards university students and elsewhere? What is your messaging towards parents?
Yeah, it's the same thing. Right now, given the stage we're in Ontario with respect to the second wave, we all need to stick to our immediate household for close contact. And for everyone else, we need to physically distance and wear a face covering. The school situation, first of all, I would like to thank parents, because I know that it's been a disruptive year so far. Every time there's a case in a class, in general, the entire class is dismissed. And sometimes they're dismissed even before we have a confirmed case, if it looks like we have a probable case, for example. And so that can be quite disruptive. And, so the schools, the school boards, the parents, they've been all, working with us to make sure that these measures, which are very conservative and protective, can continue to be applied. And so far in our region, we're seeing the cases that we expect, and sometimes we have an outbreak here or there, but overall the situation is well controlled, and so that's a good sign, right? And that's due really to the efforts of the parents, of the schools, of the school boards. So really appreciate that. And parents keeping their children home, for example, if their children are symptomatic, and as per the screening tool, they need to be assessed by a primary care provider or go get tested. So, what we're seeing when we follow up with cases, because we follow up with all the school cases, obviously, is really parents are wanting to do the right thing. They're making lots of efforts. It's not easy for them. And, there's often disruption in their lives because of it, and they have to wait for test results and things like that. So it can be very difficult, but overall we've had really great collaboration from parents, great partnerships with the schools. So we want to keep it that way. We know there'll continue to be some cases that really goes up and down in line with our overall community rates. We know sometimes we'll have outbreaks, but so far, when we've had those cases or we've had those outbreaks, we've been able to bring them under control such that we're not seeing, uncontrolled spread or other concerning things like that in the school setting.
Now, if it came down to it and the cases got really, really high within school settings, does public health have the authority to shut schools down in Waterloo Region?
Individual schools, yes. If there's a risk to an individual school setting, we would actually make the call in terms of recommending to the school board that they close that to the school board in that school, that they close the school if needed. In terms of, ending in classroom attendance in a region or in certain areas of the province, that is generally the Ministry of Education's area to make a decision on. But one of the things that all health unit areas are doing is maintaining regular contact with Ministry of Education representatives. And I know the schools are also communicating with them so that they can have an idea of how it's going in each area and whether or not they need to put in place broad restrictions in certain areas or not.
Thank you very much. Those are my questions, and sorry for being late.
No worries. I was kicked off for 10 minutes.
Yeah, we were late as well, Tim, with some technical difficulties, so it must just be our Friday. So no worries at all. We're glad you were able to join. I also will flag for you that when we send the invite, there's a link to all of our media briefing notes. And so if you do miss something or there's something said, you're certainly welcome to follow up with me, but you can also go and see Dr. Wang's full transcript of what she talked about. So if there's anything you're looking for in particular, you can go there as well. And those are on our website. So anyone who's watching can also go and look back on the many briefing notes at this point that we've created. So we have gone through the group once and everyone was great. They stuck to 3 questions or less. So thank you for that. Does anyone else have any questions for us? Okay. So we'll start with Nicole from CTV. Go ahead, Nicole.
Dr. Wang, we've been following the situation in 6 Nations where public health there have seen a spike, and we found it interesting in their press release. They're asking the public there to be honest and be forthcoming, not only with, having symptoms and getting tested, but perhaps providing information with contact tracing. Do you feel that residents have become less forthcoming when it comes to providing such information or even getting testing when they do have symptoms?
It's very individualistic, right? I would say that, most of the residents that we contact, they're very, collaborative with us. Some residents, maybe are not too forthcoming. We try to work with them, try to make them understand what it is, why it is that we need this information and that the information they provide to us will be protected, right? As you may know, we take the privacy really, really seriously, and try not to, we are under an obligation to protect their privacy. And so there are processes in place to do that. Sometimes residents are worried about that, right? Sometimes residents are worried about getting someone else in trouble if they name them. And that's also something else that we tell them. No, we don't call up a contact and say, so-and-so told me you were a contact. We just tell them you have been identified as a contact. So they're not linked back to the original case in that way. At least they're not linked back through us. And so, sometimes that can help in terms of getting people to be more, to provide us with more info. So, there can be some reasons residents are hesitant to give us info, but in general, I think what that other health unit is saying is an important message, which is we really need people, to tell us all that they know. And we know it's hard sometimes to remember everything that they've done in the previous days, when we question them about that. But we really need people to try and give us all the information that they have, because that just helps us really, improve our ability to do our contact tracing. And, and they should know that we have an obligation to protect their privacy. So their privacy is always going to be an extremely important thing for us to keep private. And we also when we do contact tracing, we also don't identify individual cases during contact tracing. So anyways, that was a bit of a long-winded answer, sorry. In summary, we need people to try to give us as much information as they can, and that's something that we as a health unit would really want to encourage as well.
Thank you.
Thanks. We'll go to Kate from CBC. Go ahead, Kate.
Thank you. I just wanted to touch on the long-term care homes and retirement homes in wave 2.
Sure.
Pretty rocky wave 1, particularly with 4 sites. We have 5 outbreaks now, although low case numbers in each of those outbreaks. But then there was the long-term care COVID-19 Commission's inquiry heard that there's an acute staffing shortage, and they heard that from one of the associations, the Long-Term Care Association. And I'm wondering, as we go into more of wave 2, how you're feeling about the state of the region's long-term care and retirement homes.
Yeah, so, what we've been hearing from our homes is what's been reported elsewhere as well. Human health resources remains a challenge in those settings. Our homes are no different. There have been improvements made across the sector in terms of knowledge and skills with respect to infection prevention and control, for example. They've been trying to recruit and get more staffing, but staffing remains a precarious element in this sector in general. And, overall, although there are individual differences, I imagine, between different homes, overall as a sector, what I've heard is this continues to be a challenge. And so that's also why health system partners have been in conversations regularly about making sure that our long-term care homes in our region are aware that if they're experiencing issues with staffing, that there are other healthcare partners that will work with them to see what can be done. So similar to what happened in wave 1, there are organizations like Home and Community Care of the LHIN, the hospitals, Ontario health teams, etc., who will get together with these homes and work with them if they indicate they are experiencing significant staffing issues and they could be at risk. So there is that, I would say, there is that regular sort of connection that's occurring between various healthcare partners to try to continue to support these homes where we can. But it is a very challenging issue across the sector. And so what I'm seeing is, I'm seeing continual improvement over time, but there are still challenges, and we still have to be extremely vigilant with these homes. So yeah, so even though the numbers are small, it is always something that's on my mind whenever we see homes in outbreak in our region. And that's also a reason that I keep trying to hammer on the message that everything that our community has been doing to moderate our rates, which has been good so far, are really important because the numbers in the long-term care homes, the number of outbreaks and cases in long-term care homes will rise as a function of the number of cases in our community that are reported each day.
Thank you very much.
Okay, thanks, Kate. Any other questions from any of you? Okay, I'm not seeing any hands go up, so we will conclude today's media briefing, and thank you all for joining us. Sorry about the technical issues we were having on our end. We will see you back at our briefing on Tuesday, October 20th. There is a Board of Health meeting that morning where Dr. Wang will be doing an update, a public health update. So we'll communicate with you in terms of what the 11:30 briefing will look like. It may just be a question and answer period because you'll have already had the update at the Board of Health meeting. But I will follow up and communicate further once we've figured that out. So that's it for today. Thank you all, and we hope you have a good and safe, and as Hsiu-Li said, physically distanced weekend. Take care.